Keisha Williams with the Joe Louis Williams III Brave of Heart Foundation. And today I have with me Dr. Claude Tolbert, OBGYN with Riverside Women's Care here in Beaufort County. How are you today, Dr. Tolbert?
I'm very well. Thank you for having me.
Well, thank you so much for being here with us today. I know your schedule is very busy. Dr. Tolbert has agreed to answer a few questions for us about congenital heart defects. So, Dr. Tolbert, what is congenital heart disease?
So, a simple definition of congenital heart defect or heart disease is any abnormality from birth that affects either the structure or function of the baby's heart.
Okay, very interesting. So, what are some of the causes of that congenital heart disease?
Well, believe it or not, the most common cause is unknown. There are quite a few babies born with congenital heart defects, and there's no traceable etiology or cause. But we do know that there are certain conditions that babies are at increased risk of congenital heart defects, and one of those will be chromosomal abnormalities. Down syndrome is the most familiar one. So that is about 25% of congenital heart defects is seen in that group.
Oh, wow, very interesting. So how are these congenital heart birth defects, how are they diagnosed?
They're most often diagnosed by ultrasound. As part of routine prenatal care, women typically will get what we call an anatomy survey at about 20 weeks of pregnancy or 5 months. And during those visits, we do a fairly detailed view of the heart. Mm-hmm. And if certain things aren't seen or we're not able to get the views we need, it raises our suspicion that there may be an abnormality with the infant's heart.
Okay. So what happens once you receive these diagnoses?
So once we identify a baby that may be at risk for congenital heart defect, that starts a cascade of events where we will refer you to a higher level of specialty care, you being the pregnant mom, and that is typically a maternal fetal medicine doctor, and you tend to find those at academic hospitals in our area. MUSC, Medical University of South Carolina, would be the referral. And there they would do a very high level fetal echo. The fetal echo is much more involved than what we would offer on what we call a basic anatomy scan. The fetal echo will be used to trace blood going to the heart, all the way through the heart, and eventually to the rest of the body.
Wow, so that is some high-tech stuff that's happening there at the hospital, University Hospital there. So are there some forms of congenital heart defects that are more serious than others? Absolutely.
There's a range of defects that can occur with the heart. Some are minor. Some may result in only a murmur that doesn't require immediate repair or treatment. But then there are others that are considered severe, known as critical congestive or congenital heart defects. Those defects are considered critical if they require any surgical treatment for repair within the first year of life for the neonate.
So what are some of the signs and symptoms that a parent might have to look for the congenital heart defect?
So the signs and symptoms vary. It depends on the defect itself, but some signs may be seen immediately at birth, where babies can go into what we call shock, cardiovascular collapse, where they're not able to maintain blood pressure. They may be born with a slightly elevated respiratory rate. We call that tachypnea. Or babies may appear blue. One of the things to look for when babies are first born is their color. Babies who are getting good oxygen tend to be pink. Babies that have more of a bluish tone, we get concerned about if the heart is working and getting oxygen to those body parts.
Okay. So is there anything that the expectant mothers can do to prevent congenital heart disease?
In most cases that we when we identify congenital heart disease, it's not necessarily anything the mom could have done to prevent it. However, there are certain conditions we know put women at, or their babies, at risk for congenital heart defects. One of the most common known ones is diabetes. Studies have shown if moms can get their hemoglobin A1Cs as low as possible, it is identified with lowering the risk of congenital heart defects. And in general, defects in general, it has been associated with a big decrease. Also, some medications that some moms may take may put them at risk of having a baby or impacting the development of the baby's heart. So the most important thing that I would like to emphasize, however, is that the prenatal care starts before pregnancy, and that if we can identify those areas in your personal history where we can intervene, we can reduce the likelihood your baby may suffer from congenital heart defect.
Okay, wow. So those were the questions that I wanted to ask you today, but was there anything else that you wanted to add that would be, very helpful to people?
Well, I think it's important just to emphasize that oftentimes pregnancies and births are very joyous, uneventful event, and it's not one where we expect there to be any bad outcomes. We're just not emotionally prepared for that, but it does happen. So you can only imagine the impact it has on a new mom and dad to go in for the ultrasound, excited. They're wanting to know what's the sex of my baby, but they leave knowing your baby may have a abnormality of the heart that may impact their prognosis or the longevity of their life. And so it takes an emotional toll. But it's important to also be prepared. And so we try to emphasize to patients the importance of what we offer as far as diagnosis, but we then begin putting you in contact with specialists that are prepared for the birth of your child, that directly impacts the prognosis of your child if they are impacted by congenital heart defect.
Well, I appreciate it. Thank you so much for sharing that information with us today. And again, thank you to Dr. Tolbert. This is coming from the Joe Louis Williams III Brave of Heart Foundation.